video.
Camera.
That's okay, check it out.
That's all good.
Okay. So again, what we're going to be doing with this video is going over shoulder pain, rotator cuff tears, rotator cuff sprains, unknown reason, sprains, slips and falls sprains, you name it. It could even be pain that isn't necessarily coming from a shoulder problem. It could be coming typically from a neck problem, which we see a lot, but sometimes even working on the neck, doing all those things and still taping where that neurological pattern can throw in some of these trigger points will definitely, the taping will help the symptoms with that. And then we can move more into the shoulder. So we can discuss into the neck and trap. So I try to have the patients, I try to have a clip, or every female pretty much with long hair, even short hair like mine, do a messy bun. Doesn't have to be crazy. Just don't hurt your arm. If they cannot move the shoulder, you're doing this for them. You're just getting the hair out of the way. Because if they can't do the arm motion even past ear, you're gonna end up doing it for them. And having a hair clip laying around, hair clips are twist, clip. So the other thing that we want to make sure to address is the pain where patients or people are talking about this pain that's here. They'll say, shoulder, my shoulder, my shoulder, my shoulder. And they'll literally just go straight to here in the front. And that's where the bicep tendon is in its groove and its attachment. And that's typically a muscular attachment problem. But when you're taping a shoulder problem, you're going to be also addressing that. That's going to be involved. The teres minor and major is going to be involved. The supra and infraspinatus is going to be involved. The rhomboids, the levator scapula. My recommendation is use quite a bit of tape, which we'll go through. We'll probably go into, you can do as little as 3 pieces. We can do as many as 5. So I'm going to start with the first 3 if you're in a hurry, if you're new to this, if you're not comfortable doing this. The 3 major ones right off the bat, okay? I also want to make sure to show you how to work around clothing, because I feel like not everybody's going to walk in and just be able to take their shirt off. So if you know that the person that you're going to need to keep taping, we're probably going to tape this, it'll last for a few days, and then it'll need to be replaced. I'm a big fan of giving the skin a 24-hour no tape, breathing, repair itself from the tape being on it. And then when you do the next tape a few days later, try to tape slightly in a different location than the last taping job. And you're like, well, how am I going to see where I taped the last? You will likely see either from the sun, because these people are usually in a sport outdoors. You will see where the tape has left like the wavy marks from the pattern in the tape. You will likely see where the skin had the tape. So again, if the tape was going here, it's been gone for a day or 2, you can kind of see where it was. Maybe just angle near it or around it and try to give that skin more time to go back to its normal appearance. Don't just throw tape on a skin that looks like that. That skin needs to repair, okay? So again, we'll start with the 3 major ones for shoulder problems, and then we'll add maybe a 4 and a 5 where the problem has gotten so severe, or it's the entire shoulder girdle itself, the range of motion, the weakness is all there, and then it's incorporating and getting accessory muscles to help move the shoulder, which then creates neck pain and then rhomboid trigger points and things like that, which I've seen a ton. So let's have some fun with some colors. If you have the pre-cut, stick with the pre-cut. We're going to probably use the pre-cut for all these pieces. If you don't, you can see here this is about the length of a forearm typically. So with this, if they can, I attempt to get them to hold the arm here. If they can't hold the arm for very long, I get them to use their other hand to help hold maybe right underneath the shoulder to give a little bit of support, because I'll show you why in a second. Sometimes these shoulders don't, there's pain with the arm hanging. And so I'd like to start here Let me show you, drop down for a second. I'm gonna aim for a pattern that's gonna swing here, and it's gonna swing here. So this one's gonna come up and attach here, and then I'm gonna bring one in and attach it here, while this arm's basically in this position. If you can hold it there, here. If they can't, just either get somebody in, a neighbor, a friend, a child, just to come hold it, or if you have a couch or a pillow or something, a table, a dining room table, if they can lay the arm there, perfect. So if you can just, whatever it takes to get this arm in this position for these first two. I'm actually going to move the clothing out of the way as I apply this. I'm gonna rub this. I'm kind of giving this a slight pull, but not attaching the end. With the end, remember, we try not to do any pull because it'll just pull right off and pull the edges up. And so if that's tiring and fatiguing, we give her a moment. We let this settle in. Switching colors for education purposes. You can just get one. Rip, tear, open. So this one, I'm making a visual map before I tape. I definitely want to come across here. I want to end about here near the collarbone. And I want this to probably end somewhere in here where tape is hopefully ending on skin and not ending on tape. So I'm going to eyeball this one. I'm going to go like 25%, 20% of the tape here. Let's do a slight turn this way. Yep. From here to here, and then the 80% of the tape finishing through here. So, see how I went backwards to get that? So turn your nose left, perfect. Just didn't want to knock you out. Getting a slight pull here, guiding here. This one's definitely not gonna end on that tape. And then I'm gonna move this out of the way, and sometimes I actually have the patient help me. Can you grab this? And then just pull that way with it, yep. And then they're just kind of exposing the skin like that, and then I'm just not doing any pulling, I'm just letting that release, and then you can let that go. And it's kind of perfect because the straps are literally holding this on there. And then drop your arm and let it hang, and sometimes that's fine to let that attach like that. And then we just kind of let that heat of her body get that going. So the next piece is going to come through, attach here onto the skin, and then come through and attach, typically not necessarily, some people do it across the joint here. We don't need to, but we can do is we can attempt, we don't want to, I'm not a fan at all, I say it over and over, of having the tape end on tape. So I'm going to aim to have this tape just finish on the skin, and then bring the piece back, and then I'm gonna have to probably slide this over this way, and she's gonna attempt to stay in a neutral position while we do that. And then you can overlap these, and then I'm going to aim, if I can feel this, and if you're not a chiropractor or massage therapist, physical therapist, you don't know what your bones feel like. If you just feel like, okay, well, there's the spine, oh, there's the shoulder blade, and the shoulder blade's all the way down here. Likely, if there's a shoulder problem, they're gonna be complaining about this spot in their back. It's typically right in here. Actually, let's turn a little bit. It's right in here, right? So shoulder blade, spine, that muscle trigger point is typically right in there. So if we can get this piece of tape that we're gonna do here to end over this, golden. If you're new, you may not get it the first shot, but at least we're trying, right? Pre-cut piece. Before I take this off, sometimes I like to just kind of eyeball this. See, this one's a little short for my liking. Oh, this is not the one that we trimmed. So we're gonna work with what we got. We're gonna aim to get this piece of tape to kind of hit over this here, just barely cover the edge of this. We're gonna aim for that one first, and then we'll be able to stretch this one enough to aim for that trigger point that's happening here and here. So if this is clothing, where clothing is an issue, all I'm gonna do is I'm not sure, just slightly, that just is perfect. give me a little bend this way they can see. All I did was move it. You can see where the strap was. There's a pink indentation. And then I moved it right here, and literally it's like completely out of my way. So it's like twist, rip, pull slightly, that gets us started. But because I keep talking about starting with this piece being so important here, I'm actually gonna come down here and bring where we don't have as much here, and then we'll get that pull and placement. So I'm gonna have where the back of my finger is touch first. And then I don't have to worry about that really anymore. Now I can focus on, with my eyes, with my guidance here, with my pull, guiding it here, right towards that trigger point. Keep your head straight for me. You don't want the patient's posture to contort while you're taping. And then here, there's no pull. It's just releasing the tape and letting it attach. Same thing here, just letting it attach. And sometimes just having the patient just say, you know, go ahead and rub some of this tape, and I'll just have the person just kind of just gently just get it heated, and then we know that it's gonna adhere better. So those are the 3 pieces that can really help a good 75, 80, 85% of just basic shoulder pain, shoulder problems, minor things. But when they're long-standing shoulder issues, these trigger points around here, maybe now we've got front and back shoulder pain, sometimes coming up in here. All I typically do is add 2 pieces, if not 1 more. The next one would be maybe skating from here and then coming across into this T1 where the neck and the trap and the shoulder kind of have that juncture. So if you don't know your anatomy, all you have to do is bend your ear to the right. You can see here where that bend is, and you're aiming to come in to there. With some patients, this shoulder, maybe they know they're gonna need surgery, and the kinesio tape is just buying them the 3 months or something until the date of the surgery. I saw a woman have to wait 11 months for a reason after a shoulder injury, surgery, second trauma, re-tear of the surgery, and then there was this huge wait period. So we put her, we did the chiropractic of the neck, we did trigger point work. It was not very comfortable for her. We did a lot of the taping where she got a ton of relief, be able to function and sleep and do her job. But we also did put her on a CBD oil for inflammation, but those combos of things just rode her till that next surgery. So with that severe issue, it was one finishing up and kind of slightly coming in the neck just a tiny bit, multiple reasons. The neck tissue is very sensitive. There's typically hair, those fine little hairs that are kind of coming in here, those baby fine hairs. You don't want hair in your tape. You just don't. It's really uncomfortable. So what we'll do is we will just show you, we want to just stop at the neck and then come in to the shoulder here. And then that next one, that other one, what we'll do is I'll show you, we're going to come low into here. Do not have to come in the arm. This is going to be just having the edge of the shoulder blade here. I particularly am a fan of it coming across the spine. I know some people don't teach that, but I feel like you cross the spine and now you're really giving that shoulder blade and those rhomboids a lot more relief, especially when people, this is the arm that they use the most. And the extreme one that I saw this really help was a ice hockey goalie, and it was the stick arm, and that arm is constantly being held right here. So let's change colors, shall we? This is my roll, so I have this huge piece. So I'm gonna, watch this, I'm gonna go too long on purpose, and then do this, and do this, and think, okay, well, without stretching it, go ahead and turn a little. I'm crossing the spine. So I probably don't want to do that. So I'm probably going to say, okay, when I stretch it, it's going to get longer. Here's taking 2 inches off. So in general, you can't go wrong with about 4 squares. Can you see the squares? Perfect. So I'm going to kind of aim for the middle, give it a little rip. peel back, peel back. This should be good. I'm aiming here, right off the edge of that bone. I'm gonna tap that down. I'm gonna do a slight pull. I'm gonna move that hair out of the way. She's got some wispies. I'm gonna guide and pull and then lay this down right into there. No, we're not. 3, 2, 1, we're starting over. Okay. You kind of have to work underneath the strap. I saw you taped over.
No, that's not a good idea.
Don't drape over the strap. You will have to throw away your tape. Okay, blooper 32. So what we're gonna do is we're gonna go with another color. I'm gonna go with 1, 2, 3, 4.5 boxes. Oh, sorry. If you don't know the boxes, boxes are on the back, and that is not pre-cut. Twist, slight tear, hardly takes any pressure. We're gonna aim here for the touchdown, right past that bony prominence. You can feel it, and then it's just tissue. I'm gonna have that attach right there. And with this one, you just have them actually in neutral, and then we're gonna get this hair out of the way. We're gonna come right up to the clothing, and this is where it gets a little tricky, because now we're just gonna go straight up and under. It's kind of a quick move. Let's see if you can see it on the film. Coming across, releasing it, laying that back down. That worked out pretty good. I'm gonna bring this up just a hair. Okay, drop that down. I know that goes against what some people teach. Get that to stick before I adhere this next one. I'm gonna give this, I'm not really gonna pull much, just a hair, and release it and lay it down. Now you can see here, go ahead and turn a little. Sorry, yep, perfect. You can see here, if I can move this in, that we didn't get all the way to the spine. There's the spine. We could have even gone a little longer. You definitely didn't want to go shorter. You could have swept this up into the neck, which I don't recommend, but you can if somebody really wants it like that. But now we're gonna do that other piece where it's gonna come across, and we're gonna do that. And we're gonna use another color because I can see that that cream isn't showing up too good. Let's go for about 4 squares on this next piece. That's where this one's gonna go. This one's all about the shoulder blade. And again, long-standing shoulder problems and teaching you how to work around clothing is really the goal here, like the common person, okay? So what we're gonna do is show you this angle. Probably gonna have you do that. Perfect. You do not need to have her arm up like that. Edge of the shoulder blade, muscular, soft, bony, right here. So I'm actually gonna go about 1 inch past and apply that right there. There's the edge of the bone. So this again is gonna be that sweeping move. Visibly, we wanna see if we can get at least over to the spine here, going past these trigger points that happen through here on those rhomboids and that shoulder blade. So I am gonna grab lower, and we're gonna sneak this through like so, and then release, and then just finish it. Going right on top of the spine, it's gonna be perfect. I'm gonna bring this around so you can see here, finishing this piece off, just giving a little heat to get that to stick, those ends to stick better. And then this piece here, just ever so slightly, you'll see here, go and relax your arm. You'll see here that this, her spine's right here. It's just crossing it. top of the shoulder blade, bony prominence is here. This one is going to be super comfortable. Okay.